the cranial nerve? Oh, okay. 4 o'clock. Can you please confirm your first name? Surname? And your date of birth with the year first, please. Okay. Yes, number. And the month. Have you been here before to the clinic? Ah, okay. I thought you look familiar, yes. Good, good. Allora, today we have you in for the trigeminal nerve. We're going to check that out for the part of the cranial nerve examination, okay? We do the facial sensation, the facial nerves, muscular, these kind of things to be sure. I'm going to put my gloves on so that I can touch your face and these things. Do I have your permission to touch your face? Maybe like the chest when I check the breathing? Okay. Fantastic. We're also going to check the optic nerve, so a little bit of the vision. It's okay. Okay. And we are going to do the taste test as well. This falls in the, yes, okay, in that portion. So maybe we move this near the trigeminal. We put that together. As well, of course, olfactory. So we're going to do the smell test. So maybe taste test first, and then the smell we will see. And we have to check the sensory, so the hearing little test, like that. Okay? So this is a little bit in depth, but it's very important to do, in my opinion, a cranial nerve exam that is a little more detailed. Okay, it's good. Good. Great. Okay, I'm going to put this note. If you see me making the note, don't worry. After I explain your result, everything. Okay. Now I'm going to put on my gloves because this way I can touch your face and these things without worry for you. These are latex-free gloves, okay? So you don't have to worry. Usually some patient of mine can be allergic to latex, but this is very allergy free. There is no, yes, good. So how are you feeling today? What brings you in for this cranial nerve? Okay. Little bit of stress. Don't worry, the cranial nerve exam, in my opinion, is it can be relaxing, to be honest. Yes, if I could put these gloves on, we can begin. I'm so sorry, but I have problems for this. So don't worry, even I make lots of mistakes from time to time, but never with the patient, okay? We will be very thorough, but not too much, okay? So don't worry about this. Each little test should take a few moments, okay? But it's good that you're here because you are the last client tonight. Yes, good. So I like to start by doing the basic breathing test. I want to test your breath. So you know how this works. If you can please breathe in and breathe out, okay? I'm going to come close. I can do this on the top of your shirt because I see it's very thin material, okay? I'm going to put this. Breathe in through the mouth. Breathe out through the mouth, very deep breath. Good, good. Again, breathe in through the mouth, breathe in. And breathe out. Strong. Good. Okay? Breathe in through the mouth, breathe in. And breathe out. Good. One more, really deep, really breathe in, give very hard. And breathe out. Good. back. Just two very deep breaths, okay? Breathe in. Breathe out. Good, good. Other side. Breathe in. Breathe out. Good. Good, good. I don't think I need this much longer, but maybe I just put here. Okay. So for me, your breathing is very good. Strong. At first it was not so strong, but when I say breathe in, you're very good. So you're doing a very good job. Okay, so no need to be nervous or stressed. It's very simple. The first part already done. I want to test your facial sensation because I think it's very, for me, interesting. So, I have object here. I'm going to get this basic. You see this? This side, it's a soft, hard. This will not hurt. I will show you right now with your eyes open so you can see. How was that? Okay, good. That was soft, and this is hard. Perfect, perfect, perfect. Okay, so now that you know what this feels like, I'm going to ask you to close your eyes and you tell me if I'm touching your face with the soft or the hard object, okay? Ready? Please close your eyes and we begin, okay? Good, good, good. Very good. Good, good, good. Good, 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 good. Good, 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 good. Very good, very good. Very good. You can open your eyes. Okay, yes. Some people fall asleep at the clinic. You might hear snoring, these kind of strange noises, but I told you it's very relaxing. Good. I want to do one more time with even more obvious object, of course. I would like for you to close your eyes, but first I'm going to touch your face with soft, hard. So ready? This is hard, of course. And this is a soft. Soft. Okay. So please close your eyes once more. Ready? Good. Soft. Good. 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 And hard. Very good, very good. Okay, you can open. Sorry, sometimes I forget to say open. Good, wonderful. You see? That was perfect. You did a very good job. Very good. I'm very proud of you. Okay, facial sensation, facial nerves. Yes, muscular, facial. Okay, this is very simple, very similar. For me, you can please, right now, stick out your tongue. Put your tongue to the left. Put your tongue to the right. Put your tongue in the mouth. Raise your eyebrows. Raise one. I know I cannot do this. Okay, I'm going to put my hands on you. Ask you to do similar. Raise eyebrow. Raise eyebrows. Okay. Can you blink for me? Blink. Good. Very good. Very good. Okay, I'm going to hold your jaw closed. Try to open your mouth, please. Good. Very good. Very good. Okay, I'm going to touch your cheeks. Can you please puff up your cheeks? Like this. Good. 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 Puff up. Yes, puff up one. Good. And puff up the other. Very good. Very good. Okay, I'm going to press. Try to keep your cheeks inflated, okay? I'm just going to press. Good. Very good. Very good. Fantastic. Yes. Okay. I want you to stick out your arms for me. Stick out. I'm going to press down, okay? So you keep your arms up. I'm going to press them, okay? Try to keep up, okay? Ready? Good, 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 good. Okay, press with the left arm and the right arm. Very good, very good. Fantastic. You see, this is not very difficult. This is not too bad. Okay, good. Yeah, your performance is fantastic, so there's no need to be nervous, okay? You're doing a great job. Very good, very good. Okay, I think I want to do next the optical, because the optical is for me very fun. I'm just going to get a light here. Okay. Please follow the light for me. Good. Follow the light, please. Okay, follow the light. You can move your head. Follow the light, yes. Good. Follow the light. Good. Follow. Okay. You can please keep your head straight. Yes. Keep your eyes forward. And please tell me when the light is no longer in the peripheral. So don't follow the light, but look. Yes. Good. Okay. Tell me when you no longer see the light. Good. Again. Good. Again. Good. Again. Good. Okay. You can follow the light with your eyes, not your head. Tell me when it's no longer in the peripheral. Okay. Ready? Again. 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 Follow. Good. Okay, please concentrate on the back wall. Don't look at the light. Okay, concentrate on the back. Don't look at the light. Very good, very good. Fantastic. You're doing really good. I'm going to bring this closer. I want to look in your eyes, okay? Please look to the left. Please look to the right. Look up. Look down. Okay. Again, bring it closer. Please look to the left. Please look to the right. Look up. Look down. Very good, very good. Okay? Concentrate on the light. Concentrate on me. Concentrate on the wall. Okay. Concentrate on the light. Concentrate on me. Concentrate on the wall. Good, good. Okay, please look left. Please look right. With both eyes. Good. Very, very impressive, very impressive. Okay. I have a simple eye chart, just to be sure. I'm going to point to the certain letter. You please read the letter. I will get a better pen for you. This is maybe difficult. Will this be okay? Good, okay. So let's start very easy. Good. 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 I'm going to put on this side. Good. 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 Can you read this one? Okay. Perhaps I'm going to be more specific. Can you read this one? Okay. Let's turn this on this side. Can you read this one? Okay. Can you read this one? Okay. If I hold a little further. This one? Okay. What about this last one? This last one? This last one. The first one here on this line. The first one on this line. The first one on this line. Good. Very good. Very nice. You're doing better than I think I would do. So that's fantastic. Okay. Your eye portion is good. I'm not very concerned. How many hours a day do you say you watch the screen on the phone or television? Does your phone tell you how many hours? Okay, interesting, yes. Good, it's not a problem, no. Okay, fantastic, fantastic. I'm going to record this for a second here. Optic trigeminal division. Now we're going to taste the taste test and then we do the smell test. Okay, and the taste test first is very important. Good. Okay. I have some flavors. These flavors today is going to be very exciting because they are in the flavor of the famous Italian dessert. We will try a few, you tell me, depending on how good you are, we do more, we do less, okay? So this is a dropper. You only need a little drop. Open your mouth, please. What flavor is that? Yes, it's very precisely tiramisu. Tiramisu, yes, we say that. Very good. I'm impressed. Good flavor. It's easy to say coffee, but then you get the afternotes of the creamy mascarpone and this flavor. Good. Okay, take another one. This will be interesting. Okay, open your mouth, please. What is that flavor? Do you taste? Yes, panna cotta. Panna cotta, yes. Similar to the tiramisu flavor, I find, but of course no coffee. You taste very much the creamy. Very good. Okay, let's give you something different. These are a little difficult, I find, but let's try another one for the season. Open your mouth. Panettone, yes, like the Christmas cake. Very nice. We will do one more to cleanse the palate, okay? What's this? Perfect. This is what I was looking for. Open your mouth. More specific. Yes. Limoncello sorbetto. Sorbet. Very good. The taste is fantastic. I'm very impressed with your taste. This is good. I put that down, okay? I'm going to just make a quick note here. You got all of them right. Good. Okay, now we are going to do, I see. This is very good. The smelling test, I really like this. I'm going to shake this bottle, looking for my box of the Q-tips. Okay. Okay. Today's theme is food related, okay? But these foods are maybe very specific. We will see if you can guess. Classic Italian dishes, okay? Yes. Okay. I'm going to keep it on the fluffy side of this. Very nice. You will tell me this is very strong. Okay. Smell this. Smell. Pesto. You smell the basilico, aglio, garlic. Yes, this flavor. Very good. Okay, I want to get another bottle. I want to get another, okay, another Q-tip. Okay, this one is very nice, very nice. Interesting. Okay, you tell me if you know what they smell like. Smell, smell, smell. Yes, it's almost like the carbonara, the pasta famous of Rome, carbonara. Good for you. You are very good, very good. Most people say eggs, bacon, but you know right away carbonara. You are very intelligent. Okay. This one is very nice, very nice. Very nice, famous food, famous food. This smells really fresh. Okay, you tell me. Smell, yes. Margherita pizza, you smell the basilico, fresh, tomato, really good. Very nice. You are amazing. Maybe I want to finish with a dessert because it's only right. This is a very good dessert, very good. Very nice. Okay, I wonder if you can smell. It's not always so easy. We will see. I want to get a fresh Q-tip. Lots of smell, so you can really smell, okay? Ready? Think about it. You smell the fry smell and the cannolo. Yes, we say cannolo when it's just one, but maybe these are more cannoli. Who knows? But you're right. Good for you. I'm very impressed with you, you know? Sometimes I wonder if the people not from here can guess the smell of the cuisine of Italy, but you're very, very astute. We will say astute. This is a word I like. I learned this recently. So we did olfactory. And smell again, 4 out of 4. So like perfect. Every test you're doing really good, really good. The eye exam is normal because if you look at the screen a lot, yes, at this time of night, the vision starts to go, but you're almost perfect. Finally, we have the sensory hearing. Okay. Now the cranial nerve is almost finished, so you're nothing to be worried. It was okay so far, right? So we are going to do the hearing portion, okay? For the hearing portion, I'm going to touch your ears a little bit, and then I'm going to whisper and you tell me certain things, okay? Good. I'm going to take one more time my medical light, and I'm just going to touch your ear and look in the ear if it's okay. Okay? Perfect. I'm going to start with this ear, it's okay? Good. Okay. Can you turn to this side a little bit? Good. Just want to get a good look. Okay, looks good. It doesn't look red. Okay. Okay. Let me touch your ear. Do you feel any pain, pressure? Okay, I'm going to touch a little bit on your... Yes, okay. How is that? Any pain, pressure? It's not swollen. Your lymph looks good. I want to do this side, okay? If you can turn just a little bit. Good. Just want to look in the ear. That's good. It's very good. Okay. Not red. Not swollen. Good. Very nice. Just going to take a look right there. Good. Okay. Going to turn this off. Press. Any pain? Good. Pressure. You tell me if this hurts at all. Okay, I'm going to feel under the glands. Good. Want to feel both at the same time. Okay, do you feel on this side anything? Good. The left is good and right. Good. The same time. I'm going to touch both of the ears. Okay. Good. Very good. Very good. I'm going to whisper in this ear. I'm going to say maybe something for the season, Christmas holiday season, okay? You tell me what I say, okay? Ready? Okay. Neve. What did I say? Good. Your pronunciation is good. I'm going to whisper in this ear, okay? Ready? Freddo. What did I say? Yeah, I'm not surprised. You're very good. Okay. I'm going to make a little bit noise in the ear, and then you're going to see if you can still hear as I whisper, okay? Ready? Buon Natale. Very good. And this one, same thing. Buon anno. Very good, very good. I'm going to make the noise in the ear. You tell me when it stops. We will do both here, then one, the other, okay? Ready? We do both here. Tell me when you no longer hear. Good. Okay, perfect. I'm going to do the left ear now. You tell me. Good. The right one, you tell me. Very good, very good. I'm going to get my notebook, just make some final notes here. Okay. As Dr. Lucia, for you, I'm going to tell your family doctor. Yes, Dr. Lolling, you said, okay? I'm going to give her the results, and then her or the nurse will contact you in 3 to 5 business days, depending, okay? Usually, no news is a good news, so if you don't hear from them in this time, it's a good news. But I can tell you, maybe you don't hear from them, okay? Unless they call to tell you good news, but usually good. The only thing I say is to limit the screen time. So maybe I want you to come in like a week, 2 weeks for the eye exam, just to be more in depth, more thorough. But otherwise your cranial nerve is very good. Okay, so we did lots of tests: trigeminal, optic, olfactory, sensory with hearing, facial, eye exam, facial sensation, facial nerve, muscular functions. You pass everything with a flying color, even in the eye exam. But of course I am not an optician, so it's not really my field to say if you need maybe more prescription or this kind of thing. So it's always recommended you go for the eye exam at least once a year, but I'm not concerned really. Okay? Yes. Oh, I'm like, these gloves are sticking to my hand. So, I'm happy to take them off right now. But you can see for the cranial nerve exam, that was a little bit more in depth. Very, very easy, right? Very, very simple. It's relaxing. Yes. Sometimes if you hear the noise of like the snoring, some people snore in the clinic, they fall asleep. It really happens. It's amazing because it's a very calming environment. These tests are very soothing. We don't like to speak too loud because we don't want the people to overhear this. For me, it's like a private. I don't want my coworker to know what's going on. But there's nothing to be private about because you are fantastic, okay? Very, very good. I'm very impressed with your ability to understand the Italian cuisine, speak the language. You are very good. This was perhaps more difficult, but you're really good. And you understand me even though I speak like this, so it's very fantastic for me. You make me feel very comfortable, so thank you for that. Okay, well, if you have any more questions or comments, you have anything to ask me? Good. Well, the hour is getting late, I see, and you probably want to go to bed and relax. So please get home safely, okay? Get home, relax, unwind, and don't be stressed. You won't hear any bad news, okay? You're going to be very fine. You're going to be fine. Good. Well, thank you for doing the cranial nerve with me. If you enjoyed, you can leave a thumbs up on the way out of the clinic. That way I know you want to see me as your doctor in the future. Good. Well, please drive safe, and I wish you very sweet dreams when you're home, okay? We say buonanotte, sogni d'oro, these kind of things, okay? So buonanotte, buonasera, buonanotte, okay?